Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the general diseases of bones. General diseases of bones may be osteitis deformans or Paget's disease, osteitis fibrosa, cystica or RECLINGHAUSEN'S disease, polyostatic fibrous dysplasia and Albright Syndrome, etc. Osteitis deformans or Paget's disease of bones. It is a generalized disease of bones. It appears to be the fibrous dysplasia of bone. The marrow space is filled with fibrous tissue. The cortex is dense, spongy and 3 times thicker than the normal cortex, tend to bend and deform. In the early stages, pelvic bones, spine, tibia and clavicles are affected. Clinical features: pain in the tibia, which is first affected and remain for years, bending of the bone, hyperemia of skin over subcutaneous bone, diminution of stature due to bending of long bones and kyphosis, anterolateral bowing of femur and kyphosis give a gorilla-like appearance. Increased diameter of head, initially identified by increased size of head. Complications: spontaneous fracture. It is first thing to have doubt of the disease. It may be a transverse fracture and occur in stages. Bone sarcoma. It may be of bone forming or bone destroying type. Osteoarthritis. It occurs in joints nearer to the bones deformed due to the alteration of the mechanism of joint. Deafness. It is due to the changes in bony framework of internal ear. Paraplegia. It may be due to the involvement of the vertebrae. Death may be due to pulmonary complications or cardiac failure. Treatment: there is no specific treatment. Pain in some cases due to faulty mechanisms can be relieved by osteotomy to have satisfactory union. Potassium iodide sometimes relieves the pain. Aspirin mixtures are better tolerated over long periods. Osteitis fibrosa cystica or RECLINGHAUSEN'S disease. It is common in second decade in long bones and skull. Generalized bone resorption results in diffuse cystic changes that are widely scattered throughout the skeleton. The destruction of bone is associated with the development of fibrous tissue. Sometimes brown tumors may develop. Fractures, pain, bending of bones and grotesque deformities occur and make the patient bedridden. Will have high serum calcium of 16 to 28 milligrams per 100 ml. Sometimes associated with the metastatic calcification. Sometimes associated with the bilateral renal calculi. May be associated with the parathyroid tumor. Polyostatic fibrous dysplasia. It is the fibrocystic disease of the bone manifested by the softening, bending and fracture with no hyperparathyroidism. The destruction is asymmetrical, affecting only one limb, monomelic. The condition starts in early life and lead to great deformity of affected limb. The bones are soft and can be cut with a knife. Albright Syndrome. This is a type of Polyostatic fibrous dysplasia associated with areas of pigmentation of the skin. When it occurs in young females, it is associated with precocious puberty. That's all about the general diseases of the bones, and in the next video I will discuss about some other disease. Thank you.